Good afternoon, and thank you for being here with us today for this informational webinar about the Mosaic Municipal Matching Grant Program. My name is Kristen Paquette. I am the CEO of C4 Innovations. C4 has the privilege of being a partner to RIZE Massachusetts on the Mosaic Opioid Recovery Partnership, and our team is supporting technical assistance for applicants and Mosaic grantees. Welcome again. Today, our team will be reviewing some key information about this grant-making round, which just launched last week. During our time together, the Mosaic team will review the Municipal Matching Grants program and purpose, including grant-making objectives, the Mosaic partnership with CARE Massachusetts that is supporting this opportunity, who should apply, how funds can be used, how to apply, and then how the awarded grant projects will be evaluated. We will then leave a few minutes at the end of the hour to answer questions from participants. Just a couple of quick housekeeping notes. As a reminder, all the participants on with us today will remain off camera and muted throughout the webinar. Please do feel free to share comments in the chat throughout the webinar. If you would like to submit a question that you're hoping for us to answer during the Q&A portion, please submit it in the Q&A box. That's the best way to make sure your question will most likely be answered today. We'll cover as many submitted questions as we can. We will also post questions and answers on the Mosaic website as soon as possible, including any that we were unable to answer during today's webinar. So to lead us off this afternoon with a reflection, please welcome Julie Burns, President and CEO of RIZE Massachusetts. Julie?
Thank you, Kristen, and good afternoon, everyone. It's great to see you all here today. Looks like we're hovering at close to 100 participants, so that's really exciting. And as Kristen said, we're here to talk about the new round of grants we launched just last week. But before we do that, we always like to start all of our Mosaic meetings off with just a moment to reflect on what this money means. So the opioid settlement funds mean different things to different people, but I think it's very safe to say that they do represent loss, devastation to communities, people who aren't here with us today because of the harms caused by overdose over the last several years. One of the things we've done at RIZE and Mosaic is to create a memory wall to remember those that we've lost, but also to remind us that our work is grounded in optimism and the hope that we can take the settlement dollars and turn them into solutions through these different grant-making programs that we are operating. A picture of the memory wall is here, and I invite you all to go on the Mosaic website, upload a memory if you have one, or just take a minute to see what's there. Again, reflect on the beautiful lives that have been lost. There are already over 200 memories on the wall, and we hope to keep this going so that each and every single person can be remembered. Next slide, please. Before we get into details about the grant program, I want to introduce our partners at CARE Massachusetts. They've been working on the project of opioid settlement funds as well, supporting cities and towns. So we wanted to give Sasha Bianchi a chance to say a few words about the work that they're doing and how they will be supporting both RIZE and all of you going forward. Sasha?
Thanks so much, Julie. So CARE Massachusetts is really thrilled to be partnering with Mosaic on these grants. And CARE Massachusetts is a training and technical assistance center that's been funded by the Bureau of Substance Addiction Services, specifically to help municipalities and municipal groups spend the opioid abatement dollars in accordance with the state subdivision agreement. And we really care about those faces on the wall too. And one of our main purposes is to help the municipalities and these groups ensure that the voices of those most affected by the overdose epidemic are included in the planning processes, that they are heard, and that these funds will reflect their needs. And other things that we can do is help municipalities and groups figure out strategies that are proven and that will be a good fit for their communities, communicating with the public about how these funds are being used, because there is a lot of public interest in these funds, and then also collaborating with other municipalities. So that can include helping municipalities figure out how to pool funds with others. So you can go to the next slide. And so there's several ways that you can connect with us. And I'm have those here on the slides. You can go to our website and you can access previous office hours or webinars that we have done. You could also get individualized technical assistance from us, ask your very specific questions about your municipality or groups, and then also sign up for our listserv. So I'm going to put all of those in the chat once I finish speaking, and now I will pass it over to Julie again.
Thanks, Sasha. So now we're going to give you an overview of the municipal grant matching program. But before we get into the details, we're giving you're hearing from a lot of people from a lot of different organizations today. So I want to make sure, it's clear who we are and what we're doing and what we're doing together. So just as Sasha said, JSI was contracted by DPH to create Care Massachusetts. RIZE was contracted by DPH to create Mosaic, the Mosaic Opioid Recovery Partnership. And our charge is specifically to create a pathway of access for municipalities and community-based or small community-based organizations, particularly those in communities that are historically underserved and have disproportionately high rates of overdose deaths, to get access to the opioid settlement funds. Next slide, please. We do our work in everything that we do, including decision-making about where the grants are going to go. We ensure that efforts are informed by commitments to equity, inclusion, and compassion. We work to reduce stigma in all of our activities, and we advocate for approaches that put a person in charge of their treatment choices about harm reduction, treatment, and recovery. Next slide, please. So this particular grant program is the Municipal Matching Grant Program. Our first program, which we made the awards in late August, was for general operating support for small community-based organizations. This is slightly different. We are focusing on matching municipal opioid settlement funds in city and towns that are using best practices to end the overdose crisis, utilizing Care Mass resources, and conducting community outreach and needs assessment, and collaborating with other, particularly those pooling funds. And we'll talk about pooling funds in just a minute. The projects and initiatives that you apply for should be developed with input from people with lived and living experience, public health experts, municipal leaders, and those affected by the crisis. This offers a unique opportunity for communities to bolster your capacity. So this is an add-on to our municipal settlement funds to address the overdose crisis through strong government and community collaboration and partnership, and to expand interventions that have been proven to save lives. Next slide, please. So the funding available, I guess this is the important part. This is a one-year grant opportunity, so it's project-based. We have 1.25 million that will be awarded in 2025. We will repeat the program in 2026 and 2027. And municipalities, including those funded in year one, can apply in subsequent years. Municipalities on their own can apply for up to $50,000 in matching funds, and we're going to go through some examples a little bit later. And municipalities that pool some or all of their settlement funds can apply for a joint project of up to $150,000 in matching funds. Next slide, please. So pooling funds, I'm sure we're going to talk, as I said, we're going to talk a little bit more about this, and we encourage you to ask questions. But pooling funds is when municipalities pool or share their resources to apply for a project. We are using the term Opioid Abatement Collaborative, or OAC, to refer to this idea of pooling funds. An OAC is any group of municipalities that agree to pool some or all of their settlement funds. OAC is a general term that can include shared service agreements or arrangements, intermunicipal agreements, memorandums of understanding, those municipalities that are working together on public health excellence grants, regional coalitions, or really any other agreement between municipalities. And again, municipalities that are pooling are eligible for a larger matching because obviously it's more than one municipality coming in as the applicant. So now I think, next slide, please. I think I'm going to pass it to my colleague, Jen Tracy.
Great. Thank you so much, Julie. Hi, everyone. Glad to have everyone on the chat. We're up to 119 participants. Very exciting. Before I continue talking, Isabel Kai is going to put up a very quick poll that we ask you to engage with. So I'm just going to pause for 20 seconds while we do this. You can see it on your screen and you should be able to click. Okay. There you can see the results. Thank you for participating. If you're in an organization, do you know how to get in touch with your municipality? And 73%, it's good to hear, does know how to reach their municipality. For those of you that are unsure or do not know how to, we will put some information in the chat on how you can get in touch with your municipality, and CareMass will be able to provide that for us. Thank you. Okay, so who should apply? So this grant program seeks to award matching funds, as Julie mentioned, to local governments and nonprofit organizations that are working together across the Commonwealth on any aspect of the care continuum, from prevention through recovery supports, and that work with communities and populations that are diverse, historically underserved, and have experienced a high rate of opioid-related overdose deaths. Next slide. Okay, now all of these entities can be the lead applicant for this grant program. Single municipalities, opioid abatement collaboratives or OACs, as Julie discussed, which are towns that are pooling their settlement funds together in a collaborative. Nonprofits can be the lead applicant with documented municipal support. And opioid coalitions may also be a lead applicant with documented municipal support. So the applicant must submit proof of the municipality's commitment to contribute matching opioid settlement funds to the initiative. And because we know that local government varies across the Commonwealth, proof of that commitment may be a formal recorded budget discussion or a commitment letter signed by the authorizing official, the mayor, city town manager. Next slide. So this is about collaboratives and OACs and coalitions. So municipalities that apply as a collaborative must designate a lead applicant, and that lead applicant is responsible to submit a letter that illustrates the municipal commitments of each city and town in the collaborative and is signed by those municipalities contributing the funds, as well as the amount of funding they're contributing. However, a municipality can be part of a collaborative even if it is not contributing funds, and that is the agreement between the collaborative. In addition, coalitions must provide documented support of matching settlement funds from any of the city and towns within the coalition that are contributing their settlement dollars. Okay, next slide. How the funds can be used. Next slide. So of course, the proposed projects must align with the Massachusetts State Subdivision Agreement. In addition, they must advance non-punitive, health-centered approaches to substance use disorder-related harms and challenges. The projects should focus on at least one of the following areas: prevention, harm reduction, access to care, recovery supports, trauma, grief, and family supports. The practice guidance has several examples for you to look at if you haven't seen them already. We picked two to share with you today. The first is an example of an OAC. So it's 8 towns are coming together to earmark 100,000 of their settlement dollars. They're going to revitalize a property for a recovery housing program. Their nonprofit partner is going to be providing the services within the recovery housing program, and they will need an additional $100,000 to hire the staff, in this case, recovery coaches, to provide support on site. So the nonprofit would be the lead applicant, and they will apply for $100,000 in matching funds with the documentation from the OAC of their commitment. So this project is a project that is a $200,000 project. The next example is a single municipality wants to purchase a harm reduction vending machine or overdose response kits. And they're going to earmark $20,000 of their settlement funds, but they'll need an additional $20,000 to complete the purchase, installation, supplies, marketing, and whatnot. So the municipality will apply as the lead for $20,000 in matching funds. Again, this is a $40,000 project. So funds may not be used for religious institutions, for-profit organizations, or direct payments to individuals or families, as well as strategies that are not included in the state subdivision agreement, or to cover other expenses not directly related to opioid remediation. And as we said before, funding may not be used for activities that cause additional harm or trauma for people who use drugs, individuals in recovery and/or treatment, and their family members. So I'm going to now hand it over to my colleague, Anne Marie Pagliano, to go over the application requirements. Thanks.
Hi, everybody. This is Anne Marie Pagliano, Associate Program Officer here at RIZE. So now we talk about how to apply, right? So on the screen, you'll see the important dates that we're working with. The most important one, I think, on here is when the applications are due. That's the third date down, and they are due November 1st. That's a Friday at 11:59 p.m. So we will keep that, that open until a minute before midnight on Friday, November 1st. So that's when applications are due. We will award the grants, make the announcement in January. It will not be January 1, that's a holiday, but it will be in January. And the grant period will begin on February 1st and run for 12 months. So all of what you should take away from this part of the webinar is everything you need to apply in terms of the application, the guidelines, questions, all of that can be found on the Mosaic website. And that's mosaic.rizema.org. On that landing page, you will see our wonderful Mosaic Apply Here, and it will give you all the information you'll need to apply. We have the grant guidelines in Spanish and English, background information, and a frequently asked questions section as well. That is populated now with a lot of questions that we have received already. And we encourage everyone, as you're going through the application process, please, 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 if you have a question, check the FAQ, but then also email us directly and we will respond to you directly. You can reach us at grants@rizema.org via email. You will get a direct reply. We will also take all of those questions that we receive. We will anonymize them and post them to our frequently asked questions. So you can check there to see if someone else may have asked the question before you. And that will get updated on a continual basis. So you can always check back if you have a new question. Another way you can get questions answered or check in with us through this process is during our office hours. We are going to hold an hour of office hours on October 10th. That's a Thursday at 1 p.m. And most everyone who's here now will be there then to answer any questions live, anything that's come up as you've been working your way through the application or discussions with partners. We're here to help and support. So please email us. Please come to the office hours. We're here to make this successful for you. And now we want to give you a glimpse of the application. On the grant guidelines on the website, you will have a list of the application questions so you can see them in advance. But when it's time to actually submit your application, you will go to the website, mosaic.rizema.org. On that page, closer to the bottom, there's a nice little orange rectangle that says application. When you click that, you will see this. All of our applications will be accepted through the website and through that link. What you see on the left-hand side of the slide here is that very first page you're going to see when you click that orange box. And it will give you all the links back to the guidelines if you need them. It also tells you that you do need to upload. The one thing we're asking you to upload is what Jen spoke about earlier, and that's the proof of the commitment from the municipality of the money that this grant would match. So as you have questions about that, we're here to answer them, but it gives you some information there about what we can accept as proof, and that would be a document that you would upload. The rest of the application, as you can see on the right side of the slide, has some radio buttons, it has some fields to fill in, it has questions. I will tell you that there are word limits on the questions that we've asked, and they might feel a little tight. That's because we just want the facts. We just want the really straight shot and understanding what's happening, who, what, where, when. Keep it really simple. We don't want you to be writing an entire novel to tell us what's going on, because we've all we know that you know what you're doing, and we just need to know the basics. When you move your way through the application online, you will be able to save your work and come back later if you need to. But if you do want to, you can complete it in one setting, whatever works for you. When you get to the end of the application, there'll be a submit button, and you know you will have submitted because you will have received a copy of the application in your email box. So you know that we will have received it. What do we do with the applications when we get them? Next slide, please. What happens then is the RIZE staff, we do an eligibility check. We make sure that everyone who has applied is eligible to apply for this grant program. Then we take the applications and give them to our community review committee. And that's a group of people that we have assembled that includes folks with lived and living experience. We say also people that have subject matter expertise, and that can mean a lot of different things. In this case, we will make sure we have folks that have experience with municipal funding and municipal programs. They will rate and score and read and discuss the applications and return them to us after they've all been scored against a common rubric. Then RIZE staff again does one more check to make sure that these, the two bullets on the slide there, are covered. These are things that Jen mentioned earlier, that that the projects address something along the care continuum, and that the projects serve populations and communities with high rates of overdose and death that have been underserved in the past. That's what this money is for, and we want to make sure that the recommendations reflect that. The recommendations are finalized, and then the awards are announced in January. So that's the process from our end. Now I'm going to turn it over to Sophia from ICH, and she will explain the reporting and evaluation portion of the grant.
Thank you, Anne-Marie. Hi, everyone. So nice to see so many people here. So I will be talking about reporting and evaluation for grantees. My name is Sophia Ladner. I work for the Institute for Community Health. We were contracted by RIZE to be the external evaluators for all Mosaic grants. So our goal is to measure the impact of this grant in a feasible, low-burden way. We will be asking municipal fund grantees to submit a progress report at the 6-month mark and at the 1-year mark of the grant. These will be, very straightforward. We'll provide the grantees with a template, and it's basically a space to share updates on what you're working on, your progress, any accomplishments and challenges, and any technical assistance support needs that you have. The second thing we will be asking for this grant is just continuous feedback as you participate in the different parts of the project. So for example, at the end of this webinar, you'll get a short survey link. And it's an opportunity to just provide immediate feedback on all the activities that RIZE is providing. And finally, we may invite some grantees to participate in qualitative interviews during the grant period. So we will be reaching out to some grantees for that, and it's just an opportunity to share in-depth feedback and impact stories from your community. So that's it for reporting and evaluation, and I think I'm going to pass it on to Kristen, but please reach out if you have any questions.
Thank you so much, Sophia and the RIZE team, for all of that information. We'll be opening it up for Q&A in just a moment. I do see we've had several questions submitted in the Q&A box. Please continue to put your questions in there. That's the best way to make sure we see them and can do our best to answer them in the time we have left today. But just a few reminders before we transition over to Q&A is really, truly, as you have questions, please do email them to grants@rizemass.org. And everybody can continue to check the mosaic.rizema.org website for updates to that Q&A document. The RIZE team is incredibly supportive and transparent around the questions and answers that come in, and make an effort to share that information as quickly as possible. On that website, you'll also find some helpful resources that might help you to put your grant together. There's resources related to data in Massachusetts that you might want to include in your proposal, grant writing best practices, ways to feature equity in your proposal. If it's not helpful to you for this round, it may be helpful in other proposals as well. So please do check that out if that could be useful to you. We do have the office hours coming up as well on October 10th at 1 o'clock, as was mentioned. We will post that registration link shortly this week, also on the mosaic.rizema.org website. So please check back for that if you're interested in joining the office hours. The other thing I'd like to just note before we begin answering questions is for anybody who's able to stay on with us through the question and answer portion, we will have one additional exit poll question that we will launch towards the end of our time together. That, again, is just helpful planning information for us. So if you are able to hang on and answer that question for us before you leave in a little bit, we would appreciate that as well. So with that, we will start fielding some of these questions here. Let's see. First question. Do match funds need to be used within a given fiscal year, or can they be carried over?
I'll take that one, Kristen. No, the money is not specifically tied to a fiscal year, but the grant period is 12 months. So we do hope that the applicants would be able to spend their money within the 12 months of the grant period. People have different fiscal years. So we didn't want to try to have you spend it by June 30, since the grant until February. So you'll have February 1st till January 31st of 2025 to spend the money.
Thank you, Julie. I do see a couple of questions coming up around the collaboration and applicant questions. So the first one here is that the organization I work for is housed under the umbrella of a church. The church is the actual 501c3, but the organization I would be applying for is a mission of the church. Does this disqualify us from applying since the church is the 501c3?
You guys hear me? Yep. Can you guys hear me? Yeah, okay, sorry. It says my internet's unstable. I apologize, everyone. That's a great question. And I saw that a few people asked similar questions. As long as the church has a 501c3 designation, if the church does not have a 501c3 designation, that you will not be able to apply in that manner. But as long as there's a 501c3, yes, you can.
Great. Thanks, Julie. Somebody is asking if we have to apply as an opioid abatement collaborative in order to apply for this grant.
Municipalities can apply on their own. So, any city or a town can apply on their own. But if municipalities are applying together, we will consider it an opioid abatement collaborative. So I hope that answers. I'm not sure if that answers the question.
If not, if whoever submitted that question, if you'd like to submit a follow-up in the Q&A, please do. I'm going to jump to another related question that I see as well. Are regional planning agencies eligible to apply on behalf of a municipality or an opioid abatement collaborative?
That is one that I believe that should be acceptable, but I think we may have to confirm that, and we'll put that in the FAQs.
Great, thank you.
Unless there's somebody else on our team that can answer that one.
Okay, so it sounds like that will be in the FAQs for sure. Somebody's curious if you have a recommendation for someone they can talk to in the municipal office to seek support so that they can apply for this opportunity.
Sasha, do you want to take that one?
Yes. So on the dashboard, the link that was shared earlier, there are contact people. I don't know if you want me to, would it be helpful for me to share what that looks like? I don't know if I can share my screen, but I can show you where on the dashboard you can find those contacts if that would be helpful. Is that something you guys you want me to do?
Yes, I think that would be great. Do we have
Okay.
share screen capability, Kristen?
Let's see.
You could definitely put it in the chat. Do you need to share your screen for a moment, Sasha?
Yes. Let me just see. Someone else is sharing. Okay, send request. And then let's see if I can share now. Okay, beautiful. So here is our dashboard. You can see that it's got all the different towns in Massachusetts. If you click on one town, like Rochester, I'm just randomly clicking on, it's kind of small. So that's why I wanted to show you. But here, right here, is who the contact person is for that town. So you see here it's Constance Dolan, and they have her email address and her phone number. So that's where you can find it. You can click on any of these towns. The current dashboard is based on last year's data, and municipalities are submitting their data now. So if you were looking at how they're spending their funds, it would be a little outdated, but in terms of contact information, those are up to date. All right, so let me just stop sharing my screen. Was I sharing my screen? I was, right? Okay.
Very, very helpful. Thank you for taking a moment to really show us and walk us through that, Sasha. Okay, back to our questions. This is a kind of an equity and data related question. We know that overdoses are highly underreported. This is especially the case in rural communities. How will these communities be equitably evaluated when the documented rates may be substantially lower than the actual rates compared to other communities?
Sorry, do you mind reading that one again?
Sure. Yeah, it's a question from somebody in a rural community, recognizing that the overdose rates in a rural community may actually appear to be lower, possibly due to underreporting, or I would imagine just compared to urban communities. How will these applications be equitably evaluated if those rates appear to be maybe less of a problem than other communities?
We use the data available from the state, so from the state of Massachusetts, to address the opioid burden in regions, cities, and towns across the state. So we have to rely on that data. But that's something that we understand is, an issue. We know that the rates may not be reflective of what's actually happening in the community. So we'll take all of that when we make the final recommendations.
Great. Thank you, Julie. A question about the match requirement. Does the match have to be cash, or could it be something physical like building or land space?
I think we'll have to put that one in. I think the answer is yes, the money has to be cash unless it's something that you've already used your municipal opioid settlement funds for. But we will put that in the chat as well. I mean, sorry, in the FAQ as well. I don't think I can answer that one.
Got it. Thank you. Question about use of funds. Could the funding be used for general operating costs for nonprofits whose services fall within the targeted goals, or does it have to be for a specific project to be completed within the funding year?
Sorry, Kristen, I lost you. I'm so sorry about this. My internet keeps going in and out. Could you repeat that? I really apologize. Unless somebody else, Jen or somebody wants to take the answer. Do you mind repeating that?
No problem. It's a question about use of funds. Could the funds be used for general operating costs for a nonprofit whose services fall within the targeted goals of the grant, or does it have to be for a specific project that would be completed within that funding year?
As long as you have a municipality that's willing to match with their funds, we would consider that.
That's great. Thank you. Somebody's asking if we could confirm the max amount available per project and municipality that will be funded. I can go back to that slide if somebody from RIZE would like to just go over those numbers again. Here we go.
Sure. So a single municipality, so a municipality on its own, can apply for up to 50,000 in matching funds. And municipalities that are pooling their funds, some or all of their funds, for a joint project can request up to 150,000.
Great. Thanks, Julie. I'll leave this slide here for a moment just because I imagine lots of participants are interested in this question. Next question, if a current SSA, single state agency, does not pool their opioid settlement funds due to town issues, are they still eligible to apply for Mosaic as a group, or are only groups that are already pooling funds eligible to apply?
I'm trying to think what the town issues might be before I answer this. So the question is whether you want to apply as an SSA or you're, I'm not sure I understand. I'm going to need a little bit more information to be able to answer that. I'm sorry.
Okay. Certainly, if anybody could submit a follow-up to that, just to clarify the question, please do. But I do wonder if it's maybe related to
So if whoever submitted that wants to either jump off mute or.
I think just to submit a follow-up question in the Q&A, we can grab. Yeah. Next question. We are an organization that supports recovery services for alcohol and substance use, but not exclusively for opioid issues. Are we still eligible to apply?
The funding is for remediation to harms caused by opioid overdose. So we will consider all applications, but if there's a question about whether your mission is appropriate, we'll deal with it during the review process.
Great. Next question, I think, is a comment that was maybe looking for feedback, but that somebody is hoping to use the funds to supply nalox boxes for municipal buildings. Any feedback on that idea?
We can't give feedback on specific ideas because obviously it's going to be a very competitive application process. But yes, if that's something that your community has determined is of interest and a necessary intervention to help stop overdoses, then I would strongly suggest that you apply.
Mm-hmm. Great. Could a coalition be the lead in a proposal with multiple municipalities?
Yes, as long as you have a written support, and we do describe what kind of support we're going to be looking for from the municipalities that will be matching the funds.
Great. Another question related to applicants. Somebody shared that they attend group meetings with several organizations, some of which are 501c3s. Would it be appropriate to share this information with them?
Yes, please, everyone on the call, share this information with anybody that you think might be interested in applying for the grant.
Mm-hmm. Great. Great. Another question on matching. If you could clarify a bit more what you mean by matching. Does the organization need to come up with a one-to-one match, or what is the ratio?
The ratio is 1-to-1. So Jen, do you want to go through the examples again, maybe?
Sure. And actually, there is another question, I believe, that is asking about the 100,000 from this example, so I can answer that as well. So the match, this grant is using opioid remediation funding from DPH. So we're going to take the settlement funding that goes to DPH, and we will match it with a municipal settlement dollars. And so municipalities receive their own settlements, and we will match those dollars. So it is specific to settlement dollars that a municipality is going to put up for a project. So the municipality or multiple municipalities can basically earmark or put on the table X amount of settlement dollars towards a project or an initiative. And this grant program will match that. If that's not clear, please ask in the chat for more info, but hopefully that's clear. There was another question. Do you see it, Kristen? Kristen, do you mind reading it about the 100,000?
maybe in the chat. Let me just take a
Oh,
look.
let me see.
Let's
I
see.
believe it was.
Yep, sure, I can read that. I think I see
You
it.
got it? Okay.
There was an example where $100,000 was a match in funding, which is more than $50,000. Is that because of the partnership with the nonprofit makes the amount up to $150,000?
Okay, and I see the participant just by looking at this example again, got the answer to his question. But yes, this was an example of a collaborative, of an opioid abatement collaborative, and they are eligible to apply for up to 150,000. So this example was 100, but yes, a single municipality may apply up to 50,000, but a collaborative is able to apply up to 150.
Great. Thanks, Jen. And definitely for folks who are if you still have questions, if you've put them in the chat, please submit them in Q&A. That's just a better way for us to definitely see them and try to answer them in our remaining time. I think a related question about match, just to confirm someone's understanding, our program runs about $90,000 a year. So the matching grant would be $45,000 a piece. Is that correct?
It would be for the project. Oh, sorry. Go ahead, Jen.
No, I missed the question. Sorry.
That's okay. I think Julie's right, though. The person's question is that their program runs about $90,000 a year as a budget. So they're asking if the matching grant would be $45,000 a piece, but it sounds like, Julie, you're saying it's more about the grant application and not the organizational budget and thinking about the match.
Correct. So if you're applying for a project that costs $90,000 a year, then the match would be 45 and 45 if you were looking for covered to fully cover your project. But it's not necessarily general operating support. So if you read the grant guidelines, Jen gave 2 examples here. I think there's 7 or maybe 8 examples in the grant guidelines, which should give you a few more examples of how the funding can be used.
Great. Going back to the question we had a few questions ago, I do see the follow-up on that one. Thank you for that. So the question is that the original opioid abatement funds are not pooled among a shared service agreement. However, the group is wanting to be able to apply to this specific match grant to create a regional project. Are they eligible or no, since they do not currently pool opioid abatement dollars?
Yes, they would be eligible if they're pooling for the purpose of applying for this grant. So we just need to have a description of the project and then a letter stating the amount of the match and from the municipalities that are involved.
Great. This question, I'm guessing there's no easy answer to, but I bet the RIZE team has some feedback. The question is, how difficult is it to get a municipality to partner with an organization? Maybe any suggestions on that front?
I mean, as Sasha said, I would connect with the official that's listed in their dashboard and begin the conversation. I think it totally depends on the type of outreach or needs assessment that the municipality has done to see if whatever project or initiative that your organization match for what the municipality thinks that needs to be done in their community. So I would strongly suggest the first step to be getting in touch.
Thanks. Question related to the data dashboard. Somebody shared that they see what their community has received so far, but how do they know how much the community gets annually?
I don't know if this is a question for me, but I believe I will check this. I don't run the dashboard, but I'm pretty sure that what will be on the dashboard will be the annual amount that you received that municipality received in the reporting year. So if it says at the top of the dashboard a certain amount, that would be the amount that they received in that year. And I know Julia's on here. I don't know if you have the answer to that, but that's the way I think it is. And I can follow up with that to confirm that answer.
We will also provide the link to the Attorney General's office information, which is probably, yeah, the best place to get that also. So we will put that link in the FAQs.
Great. Next question. For communities that have already received funding due to the state's settlement, can the municipality still apply for this grant?
Can you read that one again, please?
Sure. For communities that have already received funding due to the state's settlement, can the municipality still apply for this grant?
Yes.
Great. Another question related to the collaborative that I think we've touched on, but just to make sure we're answering everyone's question, the question is, can nonprofit organizations join together as a collaborative?
They can, as long as they have evidence of municipal support.
Thanks. Question about municipality contacts. Any suggestions for what folks should do if there is not a contact listed for the municipality? That's a tough one.
I think that one's for Sasha.
Can you ask that one again? I'm sorry, I was distracted by the chat.
Sure. The question is, what should we do if there is not a contact listed for the municipality?
That is work that we would be doing to, we are doing to try to connect with every single municipality and make sure there is at least one contact there. You know, I think I think the only other option would be just to reach out to like the town manager, the mayor, the head of the town, to try to get that information.
Mm-hmm. Okay. Another question about just sort of checking in on the eligible funding amounts. The question is, if one is one municipality working with a nonprofit allowed to apply for 150,000 as a collaborative, or is that not considered a collaborative and then $50,000 is the max?
Correct. That is not considered a collaborative. It's one municipality with a nonprofit partner. So that would be that joint project would be eligible for up to 50,000.
Great. Thank you. Next question. If a town is part of a PHE or SSA and the group applies, is that same town eligible to apply on their own as well, or can they only be part of one application?
I'm going to have Jen answer that one because I'm not 100% sure.
I think let's confirm. I believe we were going to allow that. What we're not allowing is single municipalities to apply for multiple projects with multiple nonprofit partners.
Mm-hmm. Okay. So I see the questions are slowing down a bit, so I'm going to allow just a moment to see what others we get. And I'll just acknowledge that I do see a couple of questions that we've received that I know that we've touched on. For example, another question about somebody's interested in setting up an opioid addiction / mental health library at a local library. This would include having naloxone education materials, et cetera. I think in the spirit of Julie's response to an earlier question, we can't give specific feedback about that idea, but you know, the grant goals are intended to provide that type of opioid remediation and response in communities. I also saw a very specific question for RIZE about the possibility of offering a local 10-minute presentation on Zoom. I would ask that person to please be in touch directly with RIZE, grants@rizemass.org related to that question, if you could. And I do see a couple more questions have come in. Can an organization apply for reimbursements for monies already spent within the time frame?
I'm not sure I understand the question. not sure what time frame they're referring to. But no, this would be for a new project.
Okay, so just to be clear, then you're thinking, Jen, would be the application could not say we've already spent $10,000 towards this effort. We would like to apply the grant award towards that debt or expense. Essentially, it would have to be forward-looking.
I would say yes, unless Julie, you have but yes.
Okay, great. Do we need to request funds through our town meeting every time we need to replenish?
I don't think we can answer that question. That's so specific to your town. If so, maybe JSI may be able to help with that.
What was the question again? I'm sorry.
Okay, the question was, do we need to request funds through our town meeting every time we need to replenish?
Oh, that is a question for, we have as part of CARE Massachusetts Association of Health Boards. I don't know if Cheryl is on the call today or Jen Robertson, but if you are, if you could put it in the chat. I don't think you can unmute, but or if or we can get that information to RIZE after this.
Great, thank you. Another question. May we apply for more than one activity or event?
Yes, if it's in one application.
One application, okay. Great. We have a few more minutes to take questions if anybody would like to still submit them through the Q&A. Again, I see there's been a lot of activity in the chat, which is great, but please do submit in the Q&A box if you'd like us to try to answer. Okay, here's another question. Does your municipality have to be currently working with another neighboring town to be considered, I think the question's an OAC for intents and purposes of the grant, or can they become an OAC for the grant purposes and continue to work together?
Do it for the purposes of applying for this grant.
You can do that. Okay. Great.
Kristen, can you please pull the slide that Julie went over about OAC, the general term slide? Right here. Yeah. I just want to keep that up because there's a lot of confusion about the word collaborative, and I know that's a widely used word. So what we are referring to here when we say collaborative, this is a new term, so apologies for that. Opioid abatement collaborative is a term that has been created specific to the pooling of settlement dollars between cities and towns. So yes, you can reach out if you have 5 cities or towns that are looking to do a project with this grant and want to put up some of their settlement dollars towards a common project. You have become an opioid abatement collaborative. So I just wanted to be clear on that.
Great, thank you, Jen. I did see another question come in. What do we do if the municipalities in our area have already committed their funds to our organization for general operating expenses and expansion?
Yeah, I think that this is for new projects going forward. So if trying to read the questions. Already committed funds to our org for general operating and expansions. I mean, is it why don't we're happy to sort of get a little bit more information about that specific question and try to answer it. So if you want to send it to grants at, we'll do our best to get you an answer.
I believe the answer is no.
Yeah.
But some of these we have RIZE. The RIZE team has to check with either the Attorney General's office or DPH or others because they're so specific to the municipality arrangements. So we will be sure to get all of those questions answered.
Great. Thank you, Jen. We did just get one more question. Just to clarify, one municipality with several nonprofits is not an OAC, correct? It requires multiple municipalities?
Correct. The Opioid Abatement Collaborative, OAC, is cities and towns coming together.
Thank you. I don't have any additional questions at the moment. We do have about 4 minutes left. So I would suggest, Isabel Kai, if you're able to open our final poll question for folks, we'll allow a moment for anybody who can answer that, and still happy to take questions for a couple more minutes if anybody has additional questions in mind. And of course, this question is non-binding. It's just really helpful for us to know how everyone on the call is thinking about possibly applying. And I do see one additional question, a couple additional questions we'll try to get in. Do we have to use opioid funds for our match? Can we use general funds?
It has to be opioid settlement funds.
Thanks. Can a municipality or an OAC apply with multiple nonprofits?
Yes, there'd have to be a lead. And that is that specific question on who the lead is asked in the application. And then we would just need, again, the evidence of the match from whoever's participating in the project.
Great. Could an OAC be just 2 towns?
Yes.
Great. We've still got another minute. Any final questions? We welcome them. I have seen a couple questions about whether we'll share this presentation. Absolutely. This will be posted to the RIZE Mosaic website, as well as the link for the October 10th office hours will be posted this week if folks would like to plan to attend that. And then just again, please submit your questions as you have them to grants@rizemass.org. As you can see, the RIZE team is trying to be as helpful as possible for this important opportunity. So I think that winds us down, and just want to say thank you again to everybody for your interest in this opportunity and for taking the time to bring your good questions. Julie, any final words before we go?
No, please, again, if we couldn't answer your question, as Jen said, we do have to check some of these things with the AGO office or the Department of Public Health, because they are so specific to each individual city or town. So we will get back to you. Please don't hesitate to ask questions. We're here for that. And if you have any questions related to the application process or the form itself, please let us know. We are responding as quickly as we possibly can.
Wonderful. Thank you, Julie. Wishing everyone a great afternoon. Thank you again.
Thanks, everybody.
Bye, everyone. Thank you.